think so. Okay, there we go. Welcome everybody to the 4th Crisis to Calm webinar. Thanks so much for being here. We put out a survey asking what people wanted to know about, and this is our answer to that survey. So I really appreciate you being here. I'm so happy that you're safe and that you're healthy enough to be with us. So my name is Nicole Christensen. I am a board certified patient advocate, and I'm the CEO and founder of Care Answered, as well as the author of the book From Crisis to Calm, a patient advocate's take on healthcare coordination for you, the common caregiver. So what we're going to do is talk a little bit about two different things. One is home care and how to do that, and our finances and in these economic times that we find ourselves in. So I think now, and I've said this before, we see ourselves more as patients and caregivers than ever before. And that can bring about some worry and some fear, and when we tie that together with financial stressors, it can feel a little bit overwhelming. But we're here, these webinars are really to inform and lift us. It's to be prepared and not scared. So one of the things I'd like to do is state a quote that I'm really fond of these days from the Dalai Lama. There are only 2 days in the year that nothing can be done. One is called yesterday, and the other is called tomorrow. So today is the right day to love, believe, do, and mostly live. So thank you for spending your time today with us. So with that in mind, again, I'm going to start the conversation about home care, about community Medicaid, and the changes that are happening for those that are currently on community Medicaid or are wanting to go on community Medicaid, as well as these changes that you may or may not have heard about that are going to take place potentially in October of 2020. So, and then Theresa Steinkamp, who is a wonderful friend and excellent professional, who is a CPA and financial advisor, is going to talk about navigating through these financial times as well. So, home care. So there's a lot of speculation that we seem to hear about what our households will look like in the future, how we will provide care for our loved ones. And some say that we're going to see more multi-generational households that will potentially maybe caring for our loved ones in our home. So I want to talk about how community Medicaid could potentially assist with that and those changes. Now, oftentimes within these webinars, we have people that are coming from different states. So just so that we're all aware, Medicaid is partially federally funded, but it is a state program, so it works very differently in different states. And I'm only going to be speaking about New York State. But obviously the other things that we'll be discussing will take place for everybody all across the country. So I guess the first thing, and maybe the most important thing I want to say, if you get nothing else out of this, is for yourself, for your family, for your friends, for anybody, neighbors, anybody you come across, if they are on the fence regarding community Medicaid or about finding ways or investigating how to care for their loved ones in the home, the time to get off the fence and really get to it is now. There are changes coming in the future, and from what I can tell, those changes aren't going to make it easy for anybody. So now is the time to take action. So a lot of times when people hear Medicaid, they're not necessarily familiar with the term community Medicaid. People hear the word Medicaid and they think of what is commonly called institutional Medicaid or nursing home Medicaid. So that makes sure that people can get the services that they need within an institution like a nursing home to get the care that they need and have that paid for by the state. This is not what we're going to focus on right now as we're talking about home care. So community Medicaid provides that same kind of care, but potentially not as intense, in the home. So people can age safely at home with the care that they need. And when I say that, what I'm predominantly speaking about, but there's many other services, is a home health aide that comes in the home and helps them. So I have had the opportunity with community Medicaid to truly advocate for people to get the hours that they need. And oftentimes that's things like 12 hours or 24 hours of care, or even split shift, which is 12 hours by one aide and another 12 hours by another aide in the same day. And because sometimes that is the care that is needed for people to stay in their home. So I'm going to talk a little bit about those changes that are right now during this pandemic. And I covered a little bit of this in previous webinars, so I'll try to be really brief for those that attended those webinars as well. So one of the things, those that are currently on community Medicaid, that one needs to know is that if you were to recertify, if you were up for recertification for Medicaid anytime from March 18th through June, you don't have to recertify. Your Medicaid coverage will not end due to non-recertification. So they suspended that till June. So your next recertification will actually be in 2021. So that's something that you should know. Will it extend past June? I don't know yet. I haven't seen any clarification on that, but as of now, it's certainly through June. And for those who are on community Medicaid and they get reassessed every 6 months, within this time frame, again, till June, likely, the recertification that happens on the medical side, meaning being assessed for the medical needs, won't happen. They shouldn't be happening. Have I gotten calls from my clients saying, oh, I thought they weren't happening, but they're calling me to do one through telehealth? Yes, you may get those calls, but they actually are supposed to be suspended until further notice, and there hasn't been any further notice. So those should also not be happening. As well as those who have applied for Medicaid and are waiting to do all of the things to get their care in place. So as far as the Medicaid application is concerned, it seems that that is taking a little longer through the Department of Social Services, likely due to lack of staff and other delays. So that process has been a bit delayed. However, on the other side, the medical eligibility for community Medicaid, that seems to be going along the same. Obviously, they're only using telehealth right now, but they're still doing those assessments. I haven't done as many because, again, of the hold up on the Department of Social Services to actually approve them financially for Medicaid. Okay, so that's about it for what's happening now. So what's going to take place October 2020? So these changes are set to take place October 2020. However, they can prolong it for another 3 months after that. If I don't know, and I don't think anybody knows what they're going to do, if they're going to do that. There are a lot of portions of these changes that I don't think the logistics have actually been worked out yet. But I'm going to spend this time talking about a lot about the medical eligibility changes, but I'll talk briefly about the financial. So on paper, to be eligible for Medicaid in 2020, you need to have an income of a single person. The limit is $875 a month. and the assets, the limit is $15,750. Okay, so with community Medicaid, if you work with excellent elder law attorneys and seasoned and excellent Medicaid specialists, then they could make it look lawfully, make it look on paper as if you fit that limit. So don't let that, completely obliterate your ideas of doing community Medicaid, because there are ways to work within that. And you can certainly give me a call. I know the best so that you can work with. So there was never a look back period though. So if people had, for example, transferred their money to a loved one, that wouldn't count against them. So now in October 2020, presumably, there's going to be a 2.5-year look back, a 30-month look back. So those things that you could do now to be eligible for community Medicaid, they may not be as accessible to you because there is that look back. Okay, so that's the financial changes that are certainly going to happen. So a transfer that you make now may count against you for up to 2.5 years. And the reality is, as I'm sure many of you know, is that home care can be very, very expensive. I've had clients that have gone through hundreds of thousands of dollars in a matter of months. So it's not as if, oh, okay, everybody's just banking that money. It is very expensive. So I could literally speak for a very long time on this topic, but I want to really get to the portion of the medically eligible portion. So to discuss that, I first have to speak about what ADLs are, or activities of daily living. So generally, those include ambulating or walking, dressing, toileting, eating, bathing, transferring, that means sitting up to standing or vice versa, turning and positioning in the bed, medication management. It can also include preparation of meals, routine skincare, or changing of simple dressings, like you have a small wound that needs to be dressed. In order to be eligible for community Medicaid, coming October, you're going to require physical maneuvering of at least 3 of these ADLs. And it may not be all of these 3. They may make it a shorter list than that. That is also not particularly clear at this moment. So let me give you an example. So mom has a walker. She can't walk on her own, but she utilizes a walker. She uses it very effectively and gets where she needs to go. That means there's no physical maneuvering. Okay, there's nobody physically helping her utilize that walker, or even providing a guard or a touch to allow her to utilize the walker effectively. So in that case, the mom that I just described, that would not count as an ADL. Now, they have a different criteria for those that have been diagnosed with dementia. And that is, they have to require at least minimum supervision with at least 2 of those ADLs. So supervision, I'll give another example with the walker. So dad has a diagnosis of dementia. He utilizes a walker, but he doesn't always remember how to use it or what it's for. And he's a little bit unsteady on his feet because walking has become difficult. So there's actually somebody that has to have hands on him to either supervise him, to remind him, and or to assist him physically. But supervision means, okay, this is what we're going to do now, and this is what we're going to do next, that kind of thing, which is also called cueing. And they don't have direct definitions of those, but that's how I deem their definition to be. So, and And currently, so that would be the definition for 2 ADLs for those that have a diagnosis of dementia that require at least supervision, and 3 ADLs for those that do not have a diagnosis of dementia and they need physical maneuvering. Any questions about that? Because I know I'm talking a lot. I'm checking in my chat.
Nicole, the 5 ADLs again, the 5 categories?
They're not the 5. I'm just making up these 5, honestly, because they haven't said specifically which ones. So the ones that we usually take into account: ambulating, walking, dressing, toileting, eating, bathing, transferring, turning in position. It may be still include medication management. It may still include preparation of meals or routine skincare and changing of simple dressings. We're not sure though. Okay. Good question. So then what I wanted to say after that is currently in this time before October, they used to also take into consideration to be medically eligible for community Medicaid is light cleaning and cooking, which they're going to take out of the consideration. And when we think about that, I think any of us can think of somebody that needs help with that. And if they didn't have help with that, that would cause health concerns, right? If they can't clean their home or they can't prepare meals. So that's going to be taken off as an eligibility to be medically eligible for community Medicaid. They won't consider that. That's not included in the ADLs. Okay. And so the other thing I want to talk about, as I had mentioned before, is, you know, I've had the opportunity to advocate successfully for 12-hour shifts, for split shifts, for 24-hour shifts. And now they are going to consider in their evaluation, when somebody seemingly requires 12 hours or more, they're going to actually consider whether they are safe to live in the community. So that scares me, just because who is making that judgment call? We all have rights, right? And they also you can't force somebody to be in a nursing home, right? You can't force somebody to go there. So when you think about that, and I think of, we all know an older adult or a young adult that are very headstrong, or an older adult that their one thing is that they will not go into a nursing home. And then that same person needs more than 12 hours of care to live in their home. What then happens? Do they not go into a nursing home and then they get denied care in their home? And they don't have the money to pay for that 12 hours of care every day, or 12 plus, I should say, hours of care. What then happens? So I know a lot of our friends within the community are advocating right now on many levels regarding the policy of this. Our friends at NILAG and Empire Justice and individuals like us, there's a lot we can do in regard to talking to our legislators, but this is one of the things that I'm really nervous about. But again, I know a lot of advocacy is being done, and we here at Care Answered are going to continue to advocate from now till forever. You know, it doesn't matter if the rules change, we'll still be here to advocate for people to get the care that they truly need to stay in their homes if that is their desire. There are also, again, fabulous elder law attorneys that can aid in the current time to make sure that people are Medicaid ready, as well as into the future. The planning is necessary. So again, my takeaway is that if anybody's on the fence or even thinking about it, or if they're not ready for it now is the time to find an elder law attorney that's excellent. Again, feel free to give me a call, or a Medicaid specialist, or working in conjunction with each other to help plan so that you can get the care that you need in place if that is something that that you desire, or your loved one or a friend or a neighbor. So let me see here. I see that Sangeeta wrote something. Yes, she was saying that ADLs are feeding, dressing, grooming, bathing, and ambulation, transfers, and bed mobility. However, medication, home management are considered instrumental ADLs or IDLs and not considered for Medicaid. That is somewhat true. They do definitely consider medication management currently. I don't know what that's going to be in the future. But again, the home management, as you said, Sangeeta, in the chat, is something that doesn't look like it's going to be considered at all for eligibility for community Medicaid starting October 1st or January 1st, whenever they actually put these in action. Are there any other questions?
I had a quick question.
Sure.
Is the public, or is there any venue in which we can get input into the development of the ADLs and the criteria and categories so that we can make sure that people with dementia, for example, are adequately covered as opposed to excluded from services?
Right. Yeah, it's a really big question. I just want to talk about that for just a second. When it has language like supervision in here, when that's generally the language of we don't cover supervision, that's been happening now. So it'll be interesting logistically how they figure that out. But as far as having a voice in it, as an advocate, we always have a voice. We have to, and I think your question is, who do we get to, listen to us? I would say that my best resource would be NILAG, to see what they're doing and what we can offer as our experience and expertise, whether you are a professional or a person that's just wanting to make sure that the changes go in a way that's beneficial for all. But NILAG would be the first place I would suggest.
Do you know if they have to post for public comments? They have to post the proposed regulations for public comment?
I don't think they do.
Or are they just going to provide like a user's manual or guidance? I'm
sure they're going to provide a guidance. There's many more changes that are going to be happening. Honestly, I only touched on a few. They're going to be there. The whole tool that they're going to use is going to change. Who is actually evaluating is going to change. There's a lot of things that are happening. Not many of them are really great as far as I'm concerned. And I don't really think that they know what they're doing yet, to be honest, because it's like you put it on paper and then somebody's got to figure out how to do this logistically. And then the reality is we're in the middle of a pandemic. So if I was a betting woman, I would say it'll probably start January 1, but don't take my word for that. I don't know. Let's see, Karen, what are you doing if the patient does not have a diagnosis yet for dementia or their doctor are not available to send records? What am I doing personally for my clients? Generally, I'm able to get that information, but if there is not, I certainly have had clients that are like, I'm not going to the doctor, so forget it. Beyond pandemic, they weren't going to go to the doctor, period. Sometimes I can't get a true diagnosis of dementia, and that's not necessarily a bad thing because, as you probably are aware, they don't currently managed long-term care providers often don't think of dementia as a concern in which that they have to cover. Again, one of the things that we hear often is we don't cover supervision. And so it really needs to be matched with the ADL. Any other questions? I hope I answered, because that does happen. And then there are other times that I'm able to refer and then go and advocate in the doctor's office for somebody to see a neuropsychiatrist.
Yeah, that's what I'm saying. Right now, I'm not able to get appointments, anywhere.
Right.
I would take the person, and that's, what I would usually do. I have somebody she needs a shoulder operation. She can't use her arm. She's in excruciating pain. She cannot get an appointment. See she probably needs a surgery, but we did get the surgeon to write something, you know, a letter, but it's not enough. They want to see the record, but she hasn't actually gone to have the pre-operative testing and the MRI and all of that.
Is this for Medicaid or just for an
No,
operative?
it's for, you know, I mean, it would be for really anything, you know. I mean,
Oh, okay.
you know, it's what's coming up with people who are new, who are first trying to apply for Medicaid or long-term care insurance, and, you know, they need to get that disability diagnosis and
Right.
can't really see
Generally,
that.
I've had actually, Karen, I've had some good luck working within the confines of this pandemic of getting doctors to move, actually, because they're still working, many of them, and even though people aren't utilizing their offices, so they actually have more capability to write things, or at least in my case, sign things that I write. So I haven't had that much pushback from doctors' offices actually writing things and getting things done so that they can be ready for this elective surgery, which of course is crucial for the person that needs it, but elective surgery when things do open up. Obviously no surgeries are being done, but you know, getting things in order, I've been pretty lucky.
So can I call you and and maybe
Sure,
you can do it for
absolutely.
the patient?
Yeah, absolutely, of course.
Great, thanks.
Okay, without further ado, let me introduce, thank you for the great questions, by the way. And let me introduce Theresa Steinkamp. And she's going, as I said, she's going to talk us through kind of the economic situation that we all find, this is universal, that we all find ourselves a part of, whether we're still working or not, whether our own personal economy has changed or not. So she's got tips for all of us. So she, again, Theresa Steinkamp is a CPA as well as a financial advisor, which is not very common. So she can navigate through all of these things. She's worked with my family as well as clients, and she's just a wonderful and dear friend. So I'm looking forward to taking notes on her presentation too.
Well, thank you, Nicole. I know, you know, you and I share the same values around helping others. So I'm really honored to be a part of your conversation today and share what I know, like you said, in my area of expertise, which is quite a bit different, you know, but in some ways really complements what you're discussing, right? Because maybe there's things that everybody's concerned about on a personal level, but it also could be something related to our clients, that information you can share, or our family, right? Our parents. I'm having a lot of conversations around that right now. It's a good time for people to be working through some of these issues, not just for themselves, but for their loved ones and clients. So I just want to thank everybody who's joined us today. I know everybody's so busy, but it's nice to share this time together, and I feel like it makes us a little more connected and a little bit less isolated. And also happy early Mother's Day to all the moms out there who work tirelessly for their loved ones. And I know it's a little different this year, given that we're all going to be pretty lonely on Mother's Day, but wishing everybody the best. So as Nicole mentioned, a little bit about me, I work with a lot of clients around their financial planning. So I have my own practice at Cornerstone Wealth Advisory. I'm a licensed CPA, and I'm also licensed in the areas of investments and insurance. So I work with, you know, it's interesting. Nicole and I were talking about this the other day. If I say financial planning, most people go to investments, but really, you know, with any planning, as you guys are all, you know, very familiar with across every area, it's not just one segment. It kind of, you know, you have to have a good foundation with things. So I talk to people quite a bit around their savings, which I always tell people, I know it's like a very boring conversation to talk about savings and not nearly as exciting about it as, you know, investments, but that's truly, you know, how we get to all of our goals and how we get to be able to say, oh, I'm ready to retire, or, you know, I'm ready to do all the things I want to do. So you know, Nicole asked me to speak a little bit about finances and what's going on with today's world between the virus and then the economy in general. So I'll talk through some different points, but I really want you guys to, you know, leverage me as much as you can, ask questions. If there's anything I mentioned you want me to elaborate on, or if, you know, it's just one of those things where you think about it later and you want to reach out to me and ask questions, I'm always happy to help. Nicole will distribute my contact info. And I don't know, Nicole, maybe you'll be distributing the slides as well, just in case I'm going through this too fast. I'm trying to kind of hit the high notes, but again, anything that you guys have questions on, always here to answer those for you. And don't feel like you need to do it today. You can always shoot me an email or a phone call over the next couple of days or weeks. So with that said, if we flip to the next slide, so that is just obviously my title, my background there. Beyond that, on the next slide, we're going to go through. So I find people are kind of falling, it's a weird circumstance right now. People are falling into two general categories. Those that are really struggling financially, and then those that they seem to be okay. They're nervous. Maybe their incomes haven't changed. Their jobs haven't changed. So they're looking at this and saying, okay, you know, and I've had a lot of calls around this. What can I do right now to make things a little bit better, and to make my life a little bit easier and my finances a little stronger? So we're going to go through a few of those over the next few slides. So on the next slide, I'm just going to give you some general tips, right? So people, we never learned about finances in school and college, any of that stuff. So what we know, typically most people know from just growing up and what their parents taught them. So what I tend to tell people is that my number one rule is that if you can be saving about 20% of your gross income, and that can go into different categories. It can go into savings accounts. It can go into retirement accounts. It can go into an investment account. It can go into, you know, certain other investment assets. Like, let's say you have a small rental property. I would consider that to be a savings vehicle. So, you know, that's kind of an easy trick to say, okay, let's say I took my gross income every month and I looked at it and I said, all right, well, where is everything actually going? And am I putting enough into savings? Like, am I only doing 3% into the 401k? And then am I putting, you know, maybe 2% into savings and the rest kind of gets lost in the shuffle? I regularly have people who are like, I'm embarrassed to say this, like, I have no idea. But that's really my job, is to help them in that area. And you know, I look at this all day long. So, that's, for me, it tends to be something that it's quick for me to help people figure it out. So, you know, if you guys have any questions around that, I'm happy to look into details regarding that. So, and another big question people always ask is, like, how much should I have in cash? What's too much? You know, when is it, there's not much in terms of savings, you know, interest being paid right now. How much is too much? So I would say if you have about 6 to 12 months worth of expenses in a savings account, that's a good number. Anything beyond that, you're probably, unless you have something that you've planned to spend money on that's coming up, right? I have a client who said, oh, we're planning to redo our basement. It's going to be this much. Okay, that's fine if it gets to that number, but anything beyond that, now you're up against inflation. So you're at the point where my money's going to sit there. I'm probably going to lose a little bit of value over time if I don't put it somewhere. And that's where we start to look at other options for, where does it go? But I work with a lot of people and they're like, okay, I'm ready to do this or that. And I'm like, okay, well, let's build up this cushion a little bit longer, just so that during times like this, they're not stressing out and ending up putting things on credit card. So that's a big one, because credit card, whatever rate of return you're going to earn on anything, it's going to be a lot less than what you're going to pay in interest on a credit card. So, and then again, general rule, I look at people's gross income and I say, okay, if I were to add up their mortgage, their taxes, their utilities, is that around 25% or less? And if that's the case, it makes it quite a bit easier for people to be hitting that 20% savings. The other thing I want to say in general is that I meet a lot of people and they say, you know, I'm not saving that much, but, you know, and they feel guilty around it. But it's not, all it takes is baby steps. And the second that you start to feel progress, you start to move in that direction, it gets a little bit easier. So, you know, I have plenty of people that it's taken a year or two, but they're in a much better position than they were previously before that. And then finally, the one thing I will say around, you know, the hysteria of the stock markets, right? If there's a savings plan in place and, you know, you're very thoughtful about how things are deployed amongst that plan and where each dollar goes, then you already know, hey, guess what? There's going to be this up and down of the stock market. And you should not be selling things off when you get nervous. Yeah, and yes, you should still be putting money into that 401k and not worry that it's going down, because ultimately at the end of the day, like, these are long-term plans. They're not meant for 3 to 6 months. So next slide. So a couple other areas I tell people look for. I could probably tell somebody, listen, cut 10% out of your spending, or a couple $100 every month. And I guarantee you they're able to do it. And there is literally no impact on their overall happiness. They don't find they really miss that. I think people just maybe need a little structure to say, okay, you know, what am I allowed to spend? How much is too much? And again, when you're hitting that 20% rate, don't worry about whether you're spending it on clothing or medical needs or, you know, cars or any of that stuff. It's fine. The spending is spending, but as long as you're hitting that savings target, you should not feel guilt around what you're spending your money on. I tell people, you know, right now, there's some people are like, I'm saving so much money, it's great. Like, I'm not paying for childcare. I'm ordering out a lot less. So use this time to build up your savings account a little bit more. A few people asking me about mortgage options. So I worked with a couple yesterday where they said, hey, the rates are so low, is now a good time? I would say, yes, consider it. Talk to your mortgage broker, talk to your bank. But don't forget that, yes, the rates are lower, but there's always closing costs. So you want to get a sense of, you know, ultimately, if you do refinance, what does that look like? Are you really saving all that much money? So it's definitely something to talk to your mortgage person about, or your CPA or your advisor. And I also tell people, think about, many people come in and they say, these are my goals, I'd love to hit these areas. But then when I see where they're physically putting their money, it's not at all in line with their goals. So think about that. Think about, you know, if you were to make a list, I always tell people, tell me what you want life to look like 3 years out from now. And then take a look at how you're deploying your cash and see if it's actually in line with that. And if you sit there and you figure that out and you say, well, not really. So there's some adjustments that you can make to say, all right, maybe I'm spending too much. Maybe I want to be putting more into retirement. We all have the power to do that. And like I said, I'm a firm believer in baby steps. So don't feel so overwhelmed of like, you have to get to that, you know, immediately cut back on everything that you love. I mean, that's silly. I don't work that way. I don't think that's a reasonable way to approach finances, but start with baby steps. You know, if you get a raise, try to put that aside, you know, don't increase your spending with it. Now isn't a wonderful time to work on your will, healthcare proxy, and power of attorney. I'm telling this for my clients as well as my clients' parents, right? Because we all know that if something, God forbid, happens to our parents, that tends to fall on us. So, you know, I spoke with somebody 2 days ago who said she's in her 50s, her mom's in her 80s. Her mom is still working full-time as a nurse, which is amazing. And I said to her, why don't you start the process of your will, healthcare proxy, power of attorney, and tell your mom, you know what, Mom, let's do it together. Like, let's get this done together. That way, you know, you want to do it when you're healthy. You want to do it when nothing's really wrong. You want to make those choices now, and you want to make sure you document them. And to Nicole's point, you know, reach out to us if you are wondering, like, how do I have somebody help me with that? Who's the right person to work with? we can direct you to that individual. Some people are outright saving their stimulus checks, right? They're just putting it in the bank and it's kind of becoming their rainy day fund. Not always possible for everyone, but definitely something to consider. So next slide, we're going to talk about a little more specific retirement pieces, which is, again, it looked like mostly everybody was very young on the call. So you guys probably don't have to worry about RMDs yet. But you could consider, because of the market being down, you could decide, well, I'm actually not going to take my distribution this year. But that might be something you want to talk to with your parents. If you guys have questions around that, again, reach out to me or your financial advisor. They also extended the time for you to be able to make IRA contributions. So because the tax filing got pushed out, there's time to make those as well. It'll reduce your, potentially it'll reduce your taxable income for the prior year. You can amend your tax return to do that. That's not a problem. Another option that I tell people to do, always do, is when things are good, have an open home equity line of credit. There's no cost to having that, but it's always kind of that, extra backup plan of, if things go wrong and I really need to take money out, if I lose my job, it's going to be a lot harder to get that. So you do it when times are good, and it enables you to, maybe you're not racking up credit card debt. Maybe you're using that instead, and it's a lot lower interest rate. And right now, I'm finding a lot of people are getting much better pricing on various things. So car purchases or leases. Another one really interesting is, I was reading something online the other day that it's much harder to get life insurance now. I will say it's a little more of a challenge if you have some health issues. But I will say a lot of the carriers are coming out with reduced rates. So now is a great time that if you haven't looked at it before, they're also saying no medicals, right? Because nobody wants somebody coming to their house and doing their blood work and urine and doing their weight, especially if they're going from house to house. So a lot of the carriers are waiving that right now. So great time to be looking at this. And then, just in the context of Nicole's conversation. So I work a lot with life insurance plans that have the option to add long-term care features. Again, amazing. It just means that, let's say I don't need it for long-term care in the future, then I can still take funds out and use it like a regular life insurance policy, or have a few different options to it. So now is a great time to be looking at those things. But now, what if alternatively things are not great, right? So let's say I lost my job, or I got furloughed, or my income got cut back. That's definitely happening. Some more than others, right? So my brother, for instance, works in retail. He can't, he's having a hard time getting any sense of like what's going to happen with his job. And his wife is unfortunately pregnant and due in August. So big stressor for them. So, what do you do in those cases? So there are coronavirus specific resources that the government is rolling out. As Nicole mentioned, with certain things, this is one of those things, some of it's state to state and some of it is federal. So if you could just flip to the next slide, Theresa. Perfect. Okay, so, yep, right there. So there are certain, if let's say you are in fact sick, you have to be quarantined, you're caring for a loved one, there's coverage in place right now through the FCRA rules that basically your employer can be paying your compensation up to a certain amount, and they will be reimbursed for that. So if you've made it clear to your employer that you're sick or you need to be home, they should be able to cover a portion of your compensation. So for any employers there, I would say talk to your HR specialist, talk to your employment attorney, make sure you understand the rules around this, right? Employment law tends to be really tricky. So you want to just make sure you understand the rules. So raised unemployment rate wages, again, state specific, but in the state of New York, there's an additional $600 per week. So it will make some people that are making 50 to 60,000 upwards at that range, make them totally whole being on unemployment. And that's going to last through the end of July as of now. And who knows? I mean, that, you know, we don't know what the economy is going to do over the next couple of months, but that could change in theory. It could get extended. And a lot of these things could get extended. We'll see. Yesterday I was reading about people are talking about another round of stimulus checks. I don't know if that's going to happen, right? We'll have to stay tuned. So another option I use as a little bit more of a last resort, but the CARES Act removed the 10% penalty on withdrawals from some retirement accounts, and these are for affected individuals. And then let's say you already have a 401k loan that you've taken out, they'll allow you to defer the payments on that quite a bit longer. And then there is an IRS specific limit for the amount of a loan that you can take. It's traditionally 50% of your balance. It's $50,000 up or 50% of your balance, whichever is higher. And so they've upped that to 100,000. So if that's an option, again, talk to your employer, talk to your advisor or accountant. Again, a little bit of a last resort, but sometimes that interest is a lot less than credit card debt. And then interestingly, I have a lot of clients that have received PPP loans. So they're looking to spend this money. So they're hiring people on a short-term basis to say, you know what, these are essentially free funds. I'm going to spend them on people. If people are looking for jobs, you know, I'm happy to bring them on for a couple weeks. It's something, right? If you're unemployed, it makes a difference. So put the word out, ask around, you know, do you know anybody who's hiring right now? I think now might, that kind of looking for a job might change quite a bit now, as people are getting those PPP loans. So definitely, you know, like I said, put the word out, work your network, and just continue to reach out to anyone you can. And if anybody has questions regarding, I know there's probably some business owners on the call, regarding PPP loans, EIDL loans. I have been working with that quite a bit. If you have questions around that, let me know. Next slide is debt, right? So few things here. If people are carrying credit card debt, I definitely recommend that you reach out to your credit card company, ask them for deferment. Many companies are giving 0% interest for like 3 months or so. It's totally worth asking for, right? Why not? No harm in doing that. There's also options for credit cards that offer 0% balance transfers or spending, right? Let's say you have good credit. You know that you're going to be incurring expenses as you're unemployed or your income's reduced. Check out those options. There's plenty online. If you have questions about those, reach out to me. I'm doing that quite a bit for a number of people right now who are just in a tight spot. Around mortgages, student debt, call, ask. I know the call times are really bad. And then, you know, basically make sure you're asking though, if I defer my mortgage payment or I defer my student debt, how is that going to, one, affect my credit? And two, does that mean the payment's just going to get ballooned and I'm going to owe it at the end of these 3 months, let's say, or does it get tacked on to the back of the loan? So some mortgage companies are saying, you know, we'll give you either option. You really have to, you know, maybe we'll default to the first and then you have to come back to us and request the second. So make sure you're asking those questions if you're going that route. If some people have personal investments they can leverage off of, or they might have an opportunity to refinance personal debt at this point, call, see if there's pay down amounts. I mean, these credit card companies or debt companies they definitely, you know, they're going to want the funds. Now might be a great time to look and say, hey, can I settle this debt for half of what the balance is? I think they're a lot more open to doing that now versus prior to everything that happened. And in this case, you may want to consider doing a cash out refinance on your mortgage or looking at a home equity line of credit. And then just lastly, on the spending side, these are just basics. anything that's non-essential right now, the more you spend on non-essential things, the more you're just going to add stress onto your plate, and nobody really wants that. In the state of New York, you're absolutely allowed to defer payments on your life insurance, disability insurance, and homeowners and some of those insurances, but you're going to have to call and request it, and typically those then have a balloon payment where you owe at the end of 3 months, so just be aware of that. And just reach out to your CPA about deferring tax payments. A lot of people already done that, right, with the extension. Or, you know, make sure you're on top of them. If you feel like this year you're going to get a refund, you may want that back sooner or later. So that's pretty much it on my end. I know I'm kind of racing through quite a bit of that, so I apologize if that was too speedy for you guys, but I imagine most of you are New Yorkers and are kind of used to that pace.
Thank you so much, Theresa. That was excellent. One of the things when you were talking about non-essential items and purchasing them, another colleague had mentioned about, you know, there's people that are hoarding things, you know, I don't know why, but what have you. It's not a great idea to do that, especially because that's a non-essential funds that you're spending money so that you have, you know, a room full of toilet paper. So just be thoughtful about those things before one purchases that much of something. So
for sure.
That was really helpful. Thank you. Did we have any more questions for Theresa? Yep, go ahead, Karen. Can you unmute yourself? Or can you put it in the chat? Let's see if I can unmute you. Hold on. Nope, I can't. Theresa, Jay, can you unmute her?
Yeah, I'm trying. I can't. She seems to be stuck on mute. Karen, I don't know what happened to your mic. Can you unmute it, or if not, just type to us?
Can you type it up, Karen, or no? All right. You'll get back to us in real time at some point.
Let's see if I unmute everyone, maybe.
Let's see.
No.
No, she's still muted. Everybody else is unmuted except for poor Karen. All right, so you can email us and ask us whatever questions you might have, Karen. Sorry about that. Any other questions? Well, thank you, everybody. It's 3:59, so we did it within an hour. Thank you all, and thank you for being here. And certainly let me know if you would like other topics covered. Theresa, thank you again. That was a wonderful presentation. And next week, we will be having a webinar on Wednesday. I can't recall the date, but next Wednesday at 3. So stay tuned. And again, we'll be covering some of the topics that people have asked about. And one of them will include long-term care facilities, kind of like a lot of people are confused about what that means, assisted living versus independent living versus nursing home. In the news, they call it all the same thing. And so we'll have a little chat about that and about what we think the future may look like and how we can prepare in that way. So I look forward to seeing you hopefully soon, and be well and safe. And again, happy Mother's Day, and stay safe and well. Take care.
Happy Mother's Day, everybody.
Happy Mother's Day. Thank you.
Thank you.
Bye-bye now.
Thanks a lot.
Great program.
Thank